Hello, my name is Karen Sue Smith, and I'm the editorial director here at America Magazine. I plan today to discuss with you, just for a few moments, healthcare. The dramatic rescue effort to save the lives of 33 miners in Chile has riveted the world's attention in recent weeks. It shows respect for life, that each life matters. But what would you think if one of the world's largest and wealthiest societies let not just 51 of its people, but 51 million of them go without health insurance? And in going without health insurance, most of those people wouldn't be able to find affordable coverage if they became ill. We are, of course, that nation. Before the health reform was passed into law by Congress this year, insurance companies in the United States could refuse to cover the very sick. They could drop any policyholder who became very sick. They could set annual caps and lifetime caps on coverage. They didn't have to allow parents to keep their adult children on their own family policies and pay for them to be covered. They could also raise premiums without any governmental authority to so much as ask them why, or why so much. And medical bankruptcy was the result for individuals and families whose premiums rose astronomically when some member became sick, or whose coverage was dropped, or who didn't have coverage at all. That, and much more, will change if the reform is fully implemented by 2014, as it is scheduled to be. Fortunately, some improvements have already begun. Since mid-September, some of the worst practices, some of those I mentioned, have become illegal. Insurers can no longer refuse the sick, drop the sick, or set lifetime caps on coverage. Increases in premiums must be reviewed by a federal board. The advantage of that is simply that they can look at insurance rates nationwide and see what's happening when they're asked to grant or when they refuse a rate increase. Now, already, parents whose young adult children up to the age of 26 have no access to health insurance can include them on their own policies. Is this socialism, as some opponents have charged? No, it's not. It's not even a government program. Our government has hired no doctors, no nurses. It's set up no competing insurance company. It's bought no clinic, no hospital. In fact, if the reform that's passed by Congress goes all the way through, it will enable private insurers to grow their businesses, which is a quite capitalist idea. The way they will is that the law requires every adult to buy minimal coverage. What that means for insurers is that they stand to gain some 51 million new customers. The reform also left in place the private employer-sponsored plans that currently provide coverage for most Americans. Unlike those policies, though, the reform will also try to help workers who quit, who are fired, or who leave for whatever reason and find themselves between jobs, which until now has meant also without insurance, or at least without insurance at the same rate. Eventually, individuals and small businesses will be able to purchase a plan from a statewide or regional exchange. Now, what's an exchange? It's really just an aggregate of customers that's big enough to have real buying power. And because of that, the premiums ought to be lower than those currently offered to anyone who's not in a large corporation or group. It's fairer, too. Why should healthy Americans who would rather not buy insurance be required to buy it by law? Some people are asking that. My answer? Because it benefits society as a whole. That's why. Anyone can become injured or ill, and the costs of care are high. Requiring health coverage is just like requiring drivers to buy liability insurance. Good drivers, bad drivers, new drivers, old drivers, all of them. Why? Because accidents are too risky and too expensive to let anyone, any driver, go without. Requiring health coverage is the same as requiring all taxpayers to pay for roads, even those who don't drive and who stay at home, and to pay for schools, even those without children, those who school their own children at home, and those who pay for private schools. Some goods society as a whole needs, and everyone ought to share the costs and the benefits, at least at a minimal level. Imagine what our roads and our schools would be like if whoever wanted to could just opt out of paying their portion of their taxes. With the reform, all Americans will be required to carry insurance more equally than shouldering the cost. Those with very low income will receive governmental assistance. Will the reform be expensive? Let me put it this way. Without the reform bill at all, employers have routinely seen their health insurance costs rise every year. The reform should at least reduce the size of any such increases. Those who currently carry no insurance will have to buy it. A third of the uninsured are young, working Americans. They must now enter the insurance pool. And why is that? Because insurance only works if the pool contains a mix of the healthy and the sick. This reform isn't perfect. It doesn't include a public option, so that one that would keep competition keen and prices low. It doesn't do enough to curb the constant increase in the cost of health care. No, we still have to, as Americans, cross that hurdle. Still, however, it has already removed enough waste in Medicare to prolong Medicare coverage for another decade. That's an achievement. And the reform is a vast improvement in what it offers over what we have had and over what we would have without it. If voters can keep opponents from repealing this law or from eviscerating it over the next few years, as they have promised to do, then no American need ever declare medical bankruptcy again.
Thank you very much.
This is Karen Smith for America Magazine. Thank you for listening.